Hi, Dave Carr here. I am a resident of Matthews County and I am a diabetic with coronary artery disease and a number of other little complications. And I had reached a weight of some 255 pounds and obviously became diabetic. Became increasingly sick, very lethargic, wanting to nap all the time, all sorts of stuff that goes along with diabetes and metabolic diseases such as diabetes and coronary artery disease. So in any case, I got them all. And I discovered after some time of going to the doctors, getting prescription after prescription, starting with metformin, then moving to glimepiride, and then that didn't work anymore, and then moving to Jardiance, and trying some of the other more advanced ones, and basically all of them failed. I continued to have trouble with my weight. I continued to have low energy, napping needs, and it just, no diet, no anything worked. And then my wife told me about a person who was close to her, friend, who got off all of his medications. And he did so by basically going on what is called in the parlance of the day a ketogenic diet. Now, all a ketogenic diet is a diet which eliminates essentially sugars, breads, chips, all of those kinds of things. So what I've put together here, and let me tell you, I'll tell you a tool later that helps monitor this, but basically you just stop eating certain things, and what it does is it starves your fat cells. It causes you to shift from glucose, which comes out of the breads, out of the sugars, out of the candies, out of the sodas. It stops that because your body doesn't have it anymore. Like the old caveman days when we were around and didn't have processed foods and didn't have all of the kinds of things we have now. We basically ate meat if we could catch it, and it didn't catch us. And we didn't really do much with vegetables or anything like that. So we lived really very healthy lives, very thin lives. We didn't have any problems. And so there we go. That's our history. Now we've become quite different, and it all started in the 60s and particularly picked up in the 80s. So now we have an obese population that is really sort of sick as well, with many diseases. We're talking about things that metabolically are caused by a whole lot of things, but the main one is we're eating wrong. The other things are obviously there's a little bit of autoimmune stuff out there, but it's very few people that are affected that way. So it's not genetics. It's basically how we're handling our bodies and our nutrition. And it's not taught in the medical schools. It's not prescribed by conventional doctors. It is by people who practice functional medicine. They're few and far between. So what you really have to hope for is you got a doctor who basically is open to the idea. And once they're open to the idea, you can really get better. And you get better by basically ignoring all of the dietary guidelines, all of the advertisements, all of the marketing, all of the middle aisles of a grocery store, and you start eating like you used to eat, like man used to eat some, thousands of years ago. And that is a healthy diet, or it's as healthy as we can get given we've depleted soil. We've basically messed around with the genetics of our foods. We've not been humane in the way we've raised our cattle, our meats. So there are all sorts of things. But in any case, I'm a diabetic. My A1C had climbed into the high sevens, I was not getting better. I was just getting fatter and sicker. And now, thanks to what is called this ketogenic diet, I have pretty much reversed that to the point where the difficulty in weight loss became easy. All I had to do was eat whole foods, real foods, like a good steak, and I could have as much as I wanted. And basically the weight poured off. And now I'm down to 180, about 185 pounds, give or take a two, and feeling great. I'm not napping anymore. I've got a lot of energy. I can stay up. I don't have any issues. And I'm in the process of, in a sense, in effect, reversing my diabetics, my diabetes, and also trying to go through probably a 2-year, 3-year process of reversing my coronary artery disease as well. I have the arteries of a 95-year-old man, and I'm 81 going on 82 in November. So I'm not young to start this. I'm pretty old to start this. If I'd started it 20 years ago, and if the the medical doctors and professions and hospitals and whatever had practiced better medicine and not fallen prey to a whole lot of interesting politics, which I won't get into. But in any case, here I am, I'm sitting here, my blood sugar, and I have a little meter, which is on my arm, right there, you can see it, right there. And that little meter is this. And basically I turn this thing on. It doesn't require a smartphone, though you can use one. But if I turn this on, it lights up, and I just hold it over, it beeps a little bit, and that's my blood sugar right this minute. And this is now, what, 10 o'clock, 10:30 in the morning. So I'm at 120 now, and that's a normal fluctuation of the day for me. Usually it's around 90 or 80, but in any case, it's a very good little device and is very helpful. And if you look at it, you can see your average, and I don't know if you can see this really good at all, but in any case, right now my average glucose, which is the equivalent to an A1C when you go to the doctor and get blood work, is 104 for the week. So that's pretty darn good. So that's my monitoring. Now what I've put together here are a number of videos and a list of products that help me, and foods to avoid and foods to basically eat as an alternative to those foods that you shouldn't eat in that list. So those are down below. The videos I think are incredibly helpful. I've researched, and I'm a PhD, and my specialty was research, and I have a master's degree and all but doctorate in biology. So it's easier for me than it would be for an average person, because I can understand some of the jargon that's involved in the videos. But the ones I've selected for you are pretty plain, and I hope they will be enlightening to you, because I've tried to use good presenters, people who tell it as plain as you can get it, and go through the process of what the science is behind what I'm doing, which among one things, I've thrown away all my seed oils. That's like canola, peanut oil, anything that comes out of a seed is not healthy. It's unhealthy, and it creates disease. It furthers diabetic problems and coronary problems and all sorts of things, including Alzheimer's and dementia. So, I mean, all of these things, there's a lot here. And it's because science has looked at it not at all, and now that they are, it's been suppressed. It's been suppressed by a lot of corporate money. But in any case, to go back to the diabetes issue, I have basically, and the primary thing I would emphasize is cut out sugar. And you'll see the list down under the things that help me, and the foods that I avoid and the foods that I use as alternatives. And using the alternative real foods, you can basically eat as much as you want. It doesn't matter. It helps if you also compress your eating window each day, so that you essentially skip breakfast maybe, or push breakfast forward and collapse it into lunch, and then push lunch forward. So you can eat 2 meals a day, you can eat 1 meal a day, preferably as close as you can get the two, because it helps your insulin, and your insulin helps your sugar, and everything sort of reverses over time. So it took me about 2 months to become adapted to the different kinds of food, and the weight poured off, just poured off. Went down 30 pounds, just like that. And I don't have any trouble holding it down, and I feel great. So all I'm saying is, all of this stuff's down here. You can ignore the videos if you want. I would recommend that you don't, and that you actually try to go through them. I put them in sort of an order that will explain what diabetes really is, because it's not sugar in the blood. That's a symptom. And as they treat symptoms, they further, with medications for diabetes, they actually make the disease get worse. And I know that's true, and it is really true for me. So in any case, I'm just one person. I'm not a doctor. I'm not trying to substitute for your doctor. Just really try to wade through some of this, but please, if you want to get off meds, you got to cut the sugars. And sugars is a pretty broad category. It includes breads and whatever. So do that kind of stuff, and basically try to get good sleep. Get rid of some of these seed oils, fried foods. Take some olives in a package, or take some other kinds of things. And some of them are listed below, and they're talked about in some of the videos. But I wish you luck, and if you would like to talk to me and get into the weeds a little bit, I can give you a lot more than I'm giving you here. So 725-9843. Give me a call anytime, Dave Carr, and I'd be happy to help. But in any case, good health. Health span should be your primary concern. Lifespan sort of follows health span, and you want to be healthy till the day you drop, and we're all going to drop someday. But you don't want to be in a bed for 5-7 years, or crippled, or debilitated in any way. So get healthy. My best wishes, and thank you.